Hey everyone, Robert here. I'm the founder of Shameless Care, and today I'm going to talk to you about 3 things that almost no one gets about DoxyPEP. Now, before I begin, if you're not familiar, DoxyPEP is using the antibiotic doxycycline, which has been around for decades, to reduce your likelihood of having contracted syphilis, chlamydia, or gonorrhea after unprotected sex. And unprotected oral sex, let's not forget, is unprotected sex. Now, of course, all of this needs to be under the care of a licensed medical provider, at least here in the United States, and the medication needs to be dispensed by a licensed pharmacist, both of which you can get taken care of at shamelesscare.com. All right, now without further ado, let's get right into it. Here are the 3 things that almost no one gets about DoxyPEP. The first one is that I've often heard people say, or especially on Reddit, I hear a lot of this on Reddit, why don't people just use a condom? Well, condoms are wonderful and do a great job at preventing several STIs in some important ways. But now let's not forget that gonorrhea, chlamydia, and syphilis all spread by oral sex. And a lot of people do have protected oral sex, but a lot of people do not. And if I had to wager on what is the most common thing, the most commonly I would say is that people have unprotected oral sex. What makes me so sure? Well, you can go to any place in the United States that sells condoms. You can go to Walgreens, you can go to CVS, grocery store, your local gas station, whatever you want, and go and look at that section where they sell condoms. Now, if they sold dental dams, it seems to me like they would be right there, wouldn't they? But you know what? I have never seen one. I've never seen a dental dam at Walgreens. I've never seen one at CVS. Perhaps you have. But it seems to me that if people were using protection for oral sex as commonly as we might hope that they would, that we would see those things being sold. Truth is, a lot of people enjoy unprotected oral sex. And when they say, why don't people just use a condom? It's because they're imagining that gonorrhea, chlamydia, and syphilis only spread through penis and vaginal sex or penis and anus sex. And that's just not true. They spread quite readily by oral sex. Now, the second misconception that people have about DoxyPEP is that you only need it if people have not been STI tested. I wish this were true. I wish more than anything, in fact, I wouldn't have started this company if this were true, that the phrase STI panel or getting tested for everything meant something. I wish there was some uniformity in what STI tests are comprised of, but the truth is they're not. You can go to Google right now and type complete STI testing and click on the companies who are advertising near the top and look at them carefully. They will say that they test for gonorrhea and chlamydia, but do they include a throat swab? Because gonorrhea and chlamydia are site-specific bacterial infections. You can have it in your throat, you can have it in your genitals, you can have it in your anus, you can even have it in your eye. But the important thing to know is that you can only determine if you have it in that area of your body by collecting cells from that area of your body. So for your genitals, it may be a swab or it may be a urine test. But you can get your genitals tested over and over and over and over again, and it's never going to tell you if you have an oral infection. Oral infection, you have to use a throat swab like this. Now, what's critically important here is that most oral cases are completely asymptomatic. So now think about the situation that we have here in the United States. Most people, including most physicians in their offices, are not throat swab tested, right? And then most cases are completely asymptomatic. And we already just talked about how people typically, or at least often I should say, enjoy unprotected oral sex. And there you have a recipe for disaster and one of the reasons why DoxyPEP can be such an important tool for the future. All right, now the third misconception is that DoxyPEP protects the person who takes it. That's true. People often think about this either or. I can either take DoxyPEP or I might end up in an urgent care one day getting a really painful injection in my buttocks to clear this infection that suddenly blew up and now I can't pee without pain or something like that. But it's so much bigger than that. It's so much bigger than the person who actually takes DoxyPEP. So right now in the United States, 70% of women who have chlamydia in the United States right now have no idea that they have it. And I already talked about how many cases of oral gonorrhea and chlamydia are asymptomatic. So you can see here that the issue is that people have sex, they contract one of these STIs, they don't know that they have it because there are possibly a few sociopaths out there that spread STIs knowingly, but for the most part, these spread because people do not know that they have them. So somebody has sex, they contract an STI, they then unknowingly pass it along to other people because it's not time for their next test yet, or they're completely asymptomatic, as they probably are, let's not forget. Most of these cases are asymptomatic. And then they spread it to other people, and it repeats, and it repeats. And so when someone is taking DoxyPEP, and if it prevents them from getting a gonorrhea or a chlamydia or even a syphilis, it has downstream effects that are really huge. And so it does protect the user, but it certainly protects the community at large. It's so much bigger than that. Well, there you have it. Those are the 3 misconceptions about DoxyPEP that I feel like everyone should know. The jury is still out in terms of antibiotic resistance or effectiveness on cisgender women. We're going to be covering all of those in upcoming videos. So if you learned anything, please leave a comment if you like the videos. We're going to be putting out a couple per week. And that'll really help the algorithm spread this information to other people and help improve sexual health for everybody. Again, I'm Robert from Shameless Care, and thank you so much for watching. Bye-bye.